Well, this is a pretty complicated question. It has to do with what kind of posture you assume when you're sleeping and whether or not there is a way of resolving pain by, I guess, normalizing the way you sleep. And there's no question that if you're going to spend 8 hours in bed, that you really do need to have a good bed that stabilizes your spine and neck and body. And exactly before you create physical problems, you really need to resolve those. And there are lots of things that you can do after the fact, but there are also therapies that you can, once you have these pains or these postural issues, that Dr. Reddy could treat, for example.
Body positions and pain, I don't know if they are like strongly related, but we always recommend that the patient sleep in his best comfortable position that gives him the most refreshing sleep. I don't think there is like a universal position that everybody can adopt or to prevent pain. Can we do anything about altering sleeping patterns to remove the pain threshold? I'm really not aware of anything like that, but I don't know if David knows anything.
Well, I think the approach people have taken is two things. One is they've taken some folks with mild pain and purposely disrupted their sleep in research environments, and they report more pain after that. So, for instance, we'll get referrals from the pain docs to rule out an underlying sleep disorder which may be making the pain worse. So we know that sleep's important in sort of modifying, controlling pain, whether it's posture or something else, we are not sure, but we know if they have a disorder like sleep apnea or periodic limb movements or restless legs, that's going to make it worse. So we're all about trying to optimize the sleep and hope that that tones down the pain. The other thing you'll hear about if you look on some of the websites is they're trying to find a biological marker, of course, for pain, and we've kind of stumbled across something called alpha intrusion in the brain waves, where we see this fast pattern of wake intruding into sleep, and a lot of the fibromyalgia, rheumatoid arthritis, other type pain patients will have that pattern, but it's not always there. So we're still looking, but there's definitely some relationships between pain and sleep.
Question, yes.